Welcome everyone. Today we are going to discuss about history of drug proving. Albert von Haller was the first person besides Hahnemann who felt for need of testing medicines. Haller describes in his Pharmacopoeia Helvetica that indeed a medicine must first tested in a healthy human body without adding any foreign mixture. After examination of taste, odor of medicine, small dose of it must be taken. Attention must be paid to every change that occurs to pulse, temperature, respiration and excretions. Having examined the symptoms encountered in healthy person, one may proceed to trials in body of sick person. Hahnemann was knowledgeable in different languages and used to translate many works from one language to another language. In 1790, while translating a treatise on Materia Medica by William Cullen, Hahnemann came across a statement made by Cullen in book recording cinchona bark. Cullen remarked, "I have endeavored to explain in my first outlines of practical medical science that the bark in this instant acts through its tonic effect on the stomach, and I have found nothing in any writings which could make me doubt the truth of my statements. Cinchona bark can cure malaria by virtue of its bitterness and a tonic effect on the stomach. The drug cured malaria." But this statement didn't satisfy Hahnemann, as there were plenty of better drugs but not possessing malaria curative power. By combining the strongest bitters and the strongest astringent, we can obtain a compound which in small doses possesses much more of both these properties than the bark, and yet in all eternity no favor specific can be made from such a compound. This undiscovered principle of the effect of bark is probably not easy to find. Then he thought of testing the positive action of cinchona bark on his own body. Next, Hahnemann explains, "I took for several days as an experiment 4 drachms of good cinchona twice daily. My feet and fingertips at first became cold. I became languid and drowsy. Then my heart began to palpitate. My pulse became hard and quick. An intolerable anxiety and trembling, prostration in all the limbs, then pulsation in the head, redness of the cheeks, thirst. Briefly, all the symptoms usually associated with intermittent fever appeared in succession, yet without the actual rigor. To sum up all those symptoms which to me are typical of intermittent fever, as the stupefaction of the senses, a kind of rigidity of all joints, but above all the numb disagreeable sensations which seems to have its seat in the periosteum over all the bones of the body, all made their appearance. This paroxysm lasted for 2 to 3 hours every time and reoccurred when I repeated the dose, not otherwise. I discontinued medicine and I was once more in good health." Drug after drug was tested by Hahnemann on himself, relatives, friends, with all one result. Each remedy of recognized power excited a spurious disease. After careful study of these experiments, he formulated the principle which is similia similibus curantur, let the likes be cured by likes. The substances which are able to produce diseased symptoms in healthy individual are able to cure the diseased patient. In 1796, he published an essay in Huffman's Journal, that is, an essay on new principle for ascertaining curative power of drugs and some examinations on previous principles. In this article, he put forward the homeopathic therapeutic rule, that is similia principle. In few years later, Hahnemann was able to some medicinal substances which were proved on himself, family members and some of his relatives. Fragmenta de verbis materia mentorum positivus saeva in sano corpora humana observatis. It is the first published Materia Medica in 1805, which was in Latin, published at Leipzig, Germany. It contains the pathogenesis of 27 drugs. After 6 years, in 1811, appeared the volume 1 of Materia Medica Pura, and again volume 2 in 1816, volume 3 in 1817, next volume 4 in 1818, and volume 5 in 1819, and volume 6 in 1821. In total, he investigated 99 remedies over a period of about half a century, establishing the method which has came to be known as proving or testing medicines. Developments in the field of homeopathic drug proving after Hahnemann. John Henry Clark proved many important nosodes which are pertussin, morbillinum, carcinosinum, parotidinum, bacillinum, testinum and chirinum. Jose Nunes was a Spanish Orthodox physician who converted to homeopathy. In 1864, he conducted a proving of Tarantella hispanica. Constantine Herring. He proved 72 drugs, out of which following are most important ones: Lachesis, Colchicum, Iodinum, Sabadella, Sabina, Sorinum, Crotalus, Apis mellifica, and Hydrophobinum, Gelsemium, Fluoric acid, and Phosphoric acid. History of homeopathic drug proving in India. The idea of proving indigenous drugs of India first originated in the mind of S.C. Ghosh in 1886, as he found that it is very unfortunate that the homeopaths of India have nothing to do and add to the dignity of the homeopathy. With the help of L. Salzer, who came from University of Vienna to Kolkata, voluntarily encouraged and appreciated S.C. Ghosh to prove Ficus religiosa in 1887. S.C. Ghosh proved several new indigenous drugs of India. These provings were incorporated by J.H. Clark in his Dictionary of Practical Materia Medica. Drugs proved by S.C. Ghosh: Ficus religiosa, Justice Arthropoda, and Terminalia Arjuna. Pratap Mujumdar along with T.N. Roy came into field of drug proving and proved 3 or 4 indigenous drugs of India. Drug proved by P.C. Mujumdar along with D.N. Roy are Azadirachta indica, Abroma augusta, Joniosa asoka. Drug provings, now termed as homeopathic pathogenetic trials, are conducted now by Central Council for Research in Homeopathy since the emergence of homeopathy. The process and methodology of HPTs have improved greatly. Thank you.